Osteoporosis is sometimes called a silent bone disease. Many people do not know they have it until they have a fracture. Osteoporosis is more common than many people realize. Among individuals aged 50 and older, osteoporosis affects approximately 4% of men and about 19% of women. Medicare may help cover parts of osteoporosis care, including bone density testing, doctor visits, treatment, therapy after a fracture, and some medications. Before we get into osteoporosis coverage, it helps to look at what Medicare covers overall. Part A covers medically necessary inpatient hospital stays and skilled nursing facility care. It also covers hospice and some home health services. Part B includes doctor visits, preventive services, durable medical equipment, and outpatient care. Part D generally covers prescription drugs you get from a pharmacy. Medicare A, B, C, and D can include coinsurance, copays, and deductibles. In this video, we'll walk through osteoporosis prevention, diagnosis, treatment, rehabilitation, and medications. Osteoporosis prevention starts with knowing your risks. With advancing age, several risk factors come into play, including hormone levels, smoking, and low body weight can raise risk. Medicare Part B covers most preventive services, including a yearly wellness visit. Those visits may support an osteoporosis prevention plan. A doctor may recommend weight-bearing exercise, balance training, calcium, and vitamin D. Medicare Part B covers a bone mass measurement, often called a bone density test. Blood tests may check vitamin D or calcium. Medicare Part B covers many diagnostic tests, doctor visits, and outpatient care, subject to a deductible and 20% coinsurance. A bone density test, typically a DEXA scan, is usually how osteoporosis is diagnosed. Quantitative CT scan is less common than DEXA, but can measure the volumetric bone density of the spine. Local Medicare contractors may also publish local coverage determinations for bone mass measurement. These policies often describe who may qualify, such as people with vertebral abnormalities, long-term steroid therapy, primary hyperparathyroidism, or those being monitored during FDA-approved osteoporosis drug therapy. Treatment depends on your fracture risk and overall health. Treatment may also include pain care after fractures and bone-strengthening medication. If osteoporosis leads to a fracture that requires hospital-level care, Medicare coverage for inpatient stays begins after you meet the Part A deductible. The Part A deductible applies per benefit period, not just once each year. Medicare Part B may cover outpatient osteoporosis care, including doctor visits, urgent care, ER visits, lab work, imaging, and some durable medical equipment. Recovery matters after an osteoporosis-related fracture. The goal is safer movement and stronger daily function. Physical therapy may help balance, strength, and posture. Occupational therapy may help with daily activities and safer movement at home. If you qualify, Medicare will pay for medically necessary outpatient physical and occupational therapy, as well as skilled home care. Part A applies to skilled nursing facilities when certain criteria are met. Skilled nursing care typically requires a 3-day inpatient hospital stay first. Medicare Part D usually covers prescriptions obtained at pharmacy. Osteoporosis medications may include pills, injections, or infusions. Common drug groups include bisphosphonates, bone-building medicines, and other medications that slow bone loss. Prescription drug coverage varies by plan rules, tiers, formulary, and pharmacy network. A formulary is a drug list covered by your Part D plan. A drug may require prior authorization, step therapy, and quantity limits. Part B often covers drugs given in medical settings. In most cases, this involves drugs given via injection or infusion and vaccines for prevention. With Medicare Advantage, additional rules come into play. All plans must include Medicare services. However, the guidelines can change. Network use, referrals, and prior authorization may affect access. Medicare Advantage plan rules can also affect costs and timing. Osteoporosis often remains unnoticed until a bone breaks, but early testing can help reveal bone loss. Treatment can help lower future fracture risk. Medicare may help with testing, visits, therapy, and medications. Coverage depends on medical need and plan rules. Ask your doctor about osteoporosis prevention. A few small steps can protect long-term mobility. Early action keeps treatment simpler and often less costly.